I'm Jeremy Pyle. I'm a plastic surgeon in Raleigh. I've been in practice for almost 2 years now, and about a month into practice realized that what I'd known in residency was very different than what I need to know in real life. And so I've been working with the NCMS, and we've been working together to try and figure out a way to provide residents and young physicians some guidelines and some expert opinion, if you will, about how to handle the first couple of years of practice and how to handle the transition. This is meant to be a very loose conversational environment. It's not going to be perfect. It's just sort of a perspective of folks who are newly out to help others who are in the same situation. Our talk today will be with Billy Gwaltney. Billy's an insurance professional from Charlotte, where he runs his own firm called Professional Planning Group, PPG. So thanks for joining us, Billy.
Sure, thanks for having me.
This is a relaxed environment. If you feel like we're missing something, let me know. But I just have a couple of quick questions that I want to make sure that we hit on to make sure that we don't miss the critical points. When people say get life insurance, I know that there's two basic kinds. There's term and then there's not term, basically.
Right.
And most folks say get term because it's cheaper and it provides the appropriate benefit for most people. But how much term do I get? Because people say $2 or $3 million. There has to be a difference between $2 or $3 million, or $1 and $4 million. How much do I get?
Good question. There are essentially three main approaches you can take to this. One is pick a nice round number, which you just said. Find out what your colleagues are doing.
That seems like a lot, but it seems like a nice round. $3 million seems like a lot of money.
Sure. It may be. It may be plenty. It may be plenty. The second way is taking a factor or multiple of your income. Now, the rub there is right now as a resident or fellow, your income's here. And as an attending, it's here. So the question is, do you take a multiple 10 times your current income, 10 times your future income? Some folks will do kind of split the difference and prepare themselves to not have to get additional life insurance right away whenever they leave. But it's essentially a factor, 10 times your income, okay? And you just dial it in. The third way...
So 1 is guess, 2 is 10 times the income, 3 is...
Yeah, 1 is guess, right. The second one is the multiple. The third is kind of a back into it method, which is typically necessary or more appropriate for people who have families, where you have children and you have a spouse, where you factor in what do you want to cover? What debts do you want to pay off? Do you want to pay for college expenses? Do you want to pay for private school? Do you want to pay for an income for your spouse who survives? Would he or she need to work if you pass away? So remember, you're no longer in the picture. What do they do? And how do they live? And what lifestyle will they maintain? And then you get that number, you factor in taxes, you factor in a certain rate of return, you factor in inflation, and then you present value that and bring it back, and it'll give you a more exact figure for what you need.
Probably bigger, I guess. When
you do the numbers, you'll find out that 2 or 3 million probably doesn't go as far as you might think it would over an extended period of time.
Is that taxed? If that's my only benefit to my family?
Typically, no.
With the current laws? No.
Under current law, it's not taxed. If the death benefit's received by your spouse, then they would get that income tax free.
All right. So life insurance, or rather disability insurance, comes down to the specific definition. So that would help me determine which disability plan to use. How do I determine which life insurance company to get?
It depends on what kind you're looking for. You mentioned term insurance and non-term. What's called permanent.
Well, let's assume we're talking term.
Okay, term insurance, you would want to look for a carrier who has high financial ratings and who obviously has a competitive cost. And you typically can shop that. I mean, there's not one size fits all. You can find the rates that are ideal for a male age 30 or a female age 25 or 40. Or
do I do that on the internet by myself, or is that something that you do?
You can do that. I help people do that as well, where they ask me to shop and find the best rate for their specific.
So you can't just go to Amazon?
Amazon sells life insurance?
Oh, that's what I'm asking.
I don't think so. I don't think they do. You could go to an online quote machine and plug in your information.
Are those reasonable?
Sometimes they are. They're going to assume that you're the healthiest risk, typically. And so for people that are in really good health, sure, that can be a fine way to do it. For people who may have health challenges, whether they want to admit them or not, what the carrier will do is you can submit it for that all you want, but they're going to come back and tell you what you qualify for.
So what I learned when I set my program up, health challenges is not necessarily, I mean, that's like scuba diving is considered.
It could be.
Right, or skydiving.
Could be.
So that's included in whether or not I can get and what my rates are for insurance.
Absolutely. It's the same with disability insurance, and that's also true in some ways for life insurance. It depends.
Regarding whole life insurance, or term versus whole life insurance, what's the difference?
There are two kinds. There's term insurance, which is generally designed for a specific period of time. If you need it for 10 years, 20 years, 30 years, and you know you don't need it
And it's
after
cheaper.
that, and it's the cheapest way to pay for that.
But if I don't die, no benefit
exactly
befalls of my family, right?
Exactly. So tell me when you're going to die, and I'll tell you when we can dial that in.
Right.
For people who want a certain amount of coverage to last for their lifetime is where permanent insurance comes in.
So a benefit to their family if they die when they're 90.
Exactly. Or 100 or 110. You can dial in the amount and the age that you want it to last until, and it can be contractually guaranteed for that period.
But it's more expensive
It is
by a
expensive.
significant
Potentially
number.
a lot, yes.
And one might argue that money can be better spent in different investment vehicles. When is that the right investment vehicle?
My philosophy for that is that generally speaking, you want to find out how much insurance you need and how long you need it. And is there an amount of insurance you want around for the rest of your life? For that amount of insurance, permanent insurance, typically, if you do it right, is much less expensive than term insurance over the long haul. If you try to buy term insurance from now until you're 75, it's going to be pretty expensive as you get older, a lot more expensive. Versus permanent insurance, which is more upfront, but you pay a level premium, and over the time, you're able to get it. Term insurance also assumes that you stay healthy, because you're going to have to reapply and re-enter the pool, as you say.
At 30 years or 20
At
years
some
or
point,
10 years.
if you decide.
Not till the end of the plan, though.
Not till the end of the plan. And there are a number of people who think they won't need any life insurance when they get older because of investments, because of other assets. And oftentimes they find out that's not the case. They need it for other things. And life changes, things change. And so having some amount of permanent insurance can be wise from a long-term planning point of view. The key to remember is that insurance, disability insurance and life insurance, you're looking at a financial pyramid as you're doing your financial plan. And the foundation to that starts with insurance. The cornerstone to that foundation is disability insurance. The other part of that factors in at some point, you determine when that is life insurance. And to get those things right is vital to the rest of your financial plan.